The Gambia has received the first shipment of 36,000 sizes of COVID-19 vaccines through the COVAX facility, less than a week after the Ministry of Health finalized and submitted the required documentation for delivery of vaccines to the country. The vaccines were shipped by UNICEF on behalf of COVAX. From the Serum Institute of India, the UNICEF representative, Jonathan Lewis, was at the airport to witness the arrival of the vaccines. This is what he has to say.
Not only are we helping bring the vaccines to the country, but we're also going to be working with you, Minister, and your teams to ensure that the vaccination plan, once it's ready to be rolled out, and we hope that it's as soon as possible, we will also be there by your side. This particular consignment of 36,000 vaccines is one of several consignments that will be coming in over the next couple of months, because there is an indicative amount for the Gambia which has been pegged at a maximum threshold of 180,000 vaccines that we hope will be arriving in total before the month of June.
The WHO representative, Dr. Desta, was also at the airport late Tuesday to witness the arrival of the vaccines.
And the COVAX aim is actually there are certain objectives that we want to achieve through this collaboration. One is to ensure that the vaccines are for the 20% of the population, which is estimated to be at higher risk because of the nature of the job or because of the nature of, some conditions. They are more exposed and they are likely to develop serious illness. Vaccines will be available at least for the 20%. The second one is accessing diverse portfolio of vaccines through this COVAX arrangement. It's not only one vaccine. In the COVAX for now, we have AstraZeneca, but tomorrow we are expecting, I think in few days or months' time, more and more vaccines to come in this basket. And then that will increase also the likelihood of getting this access to the vaccines. And vaccines are also at the same time delivered as soon as possible, as soon as they are available. This is a testimony. We don't have enough vaccine in the world, but whatever is available through COVAX arrangement, we are able to deliver 36,000 for the Gambia, at least to reach to those that are at high risk.
The Minister of Health, Dr. Samateh, calls on Gambians, especially those regarded as high-risk group, to help protect themselves, their families, and the entire population of the Gambia from COVID-19 by making themselves available for vaccination.
We all have a very important role to play in the success of the response. And I urge every one of us to continue, because it's not over yet. COVID-19 is very much around. As we speak to you, we continue to lose people to COVID-19. So we should maintain the social distancing, which increasingly becomes difficult, even at this venue. As we start socially distant, we gradually crowd together again. Of course, it is difficult, but we must ensure that we maintain social distancing. We put on the face mask, we continue the hand hygiene, and make sure that we continue the cleanliness that we all had adopted or increased at the beginning of the pandemic, because anything that kills people, I think, is very serious, and people continue to die of COVID-19. Yes, the vaccine, we want people to make themselves available, accept the vaccines so that we are protected. But of course, the arrival of the vaccines should also not mean that we should be complacent and we forget about every other preventive method. They go together. So it is the vaccines come to strengthen our response, our strategies. It's part and parcel of the preventive strategies. The vaccination is part and parcel of them.
The establishment of COVAX facility by Global Alliance for Vaccine and Immunization, Gavi, World Health Organization, and Committee of Pandemic Preparedness Initiative to help mobilize and pool resources to enable lower and middle-income countries have access to high-quality vaccine, which was seen to be the only intervention that can bring the pandemic under control. The COVAX will provide vaccine for 20% of the population through the COVAX facility. Reporting for Kerr, Fatou, I am Buba Gajigo.